10 new cases outside China.
Thank you, Dr. Daniel Kertesz, to join us on the TV program. First of all, I would like to ask you, what is your take on the situation of the coronavirus outbreak in China and the rest of the world? Because some experts give comments that the outbreak may be peaking in China, but it's just the beginning in the rest of the world.
First of all, thanks for having me here and giving me the opportunity to talk about this really extraordinary event. We all of us around the globe are living in an extraordinary time. The WHO really acknowledges the concern and the fear that people have for their own health and the health of their families. It's extremely unsettling when a virus like this is discovered and begins to spread in a country or around the world. What we do know about this virus currently, and things are changing every day, we do know that the epicenter of this epidemic is still in China. It's still in Hubei province. Most of the cases being reported in the world are coming from China. We do know, however, that there have been 24 countries that have reported cases, over 450 cases occurring outside of China. But what we're seeing is that up to now, those cases, the cases reported outside of China, have really been limited in the scope of transmission. We're not seeing the kind of widespread person-to-person transmission outside of China that we are seeing inside of China. And I think this gets to your question and really to the strategy that WHO has taken at a global level and that countries who are affected have taken. And our real strategy now is to limit the spread of this virus in countries and in populations outside of China. And we can do that in really the most important way that we do that, the most important way that we limit the spread of the virus in people is to identify cases very quickly, very aggressively, isolate them, treat them well, treat them supportively, and ensure that their contacts are identified and those contacts are followed up in case they get sick. If we can identify the contacts and isolate those, we have a really good chance of breaking the chains of transmission and potentially preventing the kind of situation like we're seeing in China.
How about the vaccine that can cure those infected people?
So there is currently no treatment or vaccine available for this virus. That doesn't mean there won't be in the future. In fact, WHO has just convened and hosted a research and development conference for over 300 participants from all over the world, in which the participants shared experiences, scientific experiences, their scientific knowledge, in order to develop a blueprint for how we go forward to develop drugs and vaccines. It is possible that a vaccine would be available. WHO has, normally for a vaccine to become available, any vaccine in regular times, it would take, it could take up to 5 to 10 years. There is a fast track for vaccines in emergency situations, but we shouldn't count on a vaccine in the near future to help us with this problem. The problem will be solved and managed by the things that I just talked about. Identifying patients, identifying people with the disease, isolating them, following up their contacts to make sure that chains of transmission are interrupted.
Earlier this week, Dr. Tedros, the chief of the World Health Organization, said that there is a positive chance of stopping a virus. So what are the positive signals?
Yeah, I think what Dr. Tedros was referring to was, again, that what we're seeing outside of China, and that we're not seeing the kind of spread in the community from person to person outside of China. So Dr. Tedros has called this a window of opportunity, and it's a window of opportunity to sort of to potentially stop the virus from entering into the community where it could be spread more rapidly and more easily. And I think this is the approach that we are taking. This is the strategy that the WHO recommends. This is the strategy that Thailand is currently taking. I think that this is it's a good strategy. We need to keep following this disease, getting information about it, but we do need to plan for the possibility that we see more widespread transmission in the population.
The infections of the coronavirus outside China is stable right now, right?
It appears to be stable right now, but again, what we say today may be different tomorrow, and this is part of the. This is really part of what is so unsettling for everybody about this event. We know things today, we might be contradicted tomorrow, things might change tomorrow. So we have to keep open minds, keep our networks of communication up, keep our partnerships up, and continue to work together.